This is The Changed Physician, episode 194.
Hey, folks, welcome back to another episode of the Changed Physician podcast. This is your host, Dr. Kevin Cuccaro, with my Amazeballs co-host, Dr. Melissa Cady, and our fantastic returning guest and new father, Dr. Paul Thomas of Plum Health. You all may remember Dr. Thomas way back when we did some episodes on direct primary care, something that Melissa and I are both very passionate about, in which Paul has done some amazing work in his area with and is really a leader in that space. But we're going to talk about something completely different. Before we begin, Paul, how are you doing today?
I'm doing great. Thanks so much for having me. It's great to be here.
And I was saying, you look really well for having a newborn in your house, and don't look sleep deprived at all. So very congratulations there. But we brought you on the show today to talk about was your new book that you have, which is titled Dressing Well in Medicine: What to Wear for Your Medical School Interviews and How to Dress Professionally Throughout Your Career in Medicine. And when you first let me know about this book, the first thing I was thinking was, well, that's super cool. I don't know how you figured out the time to write this thing in the middle of a pandemic as a business owner and primary care during, COVID, and then also finding out that your wife is pregnant and about ready to have a kid. But the other part that I think is really going to be the heart of this conversation is this is a topic that even off air, you said, we're in the middle of a pandemic, people are dying, and yet you decided to publish this book. Why is this important to you? And why do you think it's important to your colleagues and people entering this profession?
Yeah, there's a lot there. There's so many layers to this. And I'll have to admit, this is not the most important topic in medicine. However, at the same time, these things need to be said, and they're not written down anywhere. They're not discussed. Some people will frown on you for talking about clothing as something that's completely superficial and not germane to the profession. However, I think it's really important about how we present ourselves, not only as physicians, but as physician leaders, so that we can reshape this healthcare system to be more humane, more just, more equitable for physicians and for patients and for communities. And ultimately, we need to dress our best so that we can uplift that physician-patient relationship. That's the most important thing. How can we dress in a way that elicits the trust and confidence of our patients and the people in our community, so that we can be physicians and physician leaders and healers in our community? And that's the essence of this book.
And that, I have to say, really changes the conversation for me, because that was an angle that I never thought. Because most people will talk about dressing professional and making this first impression. It's very much about me. How is it that I can enter a room so I can look nice, so I look at as a certain status or a certain way, so that people then basically give me what I want, or at least have that favorable perception that puts me in sort of a longitudinal relationship where I am recognized as a trustworthy person. But I've never heard it framed this way that you said. And correct me if I'm wrong, or my perception of what you said is not the case. The way you're presenting this is basically the way you dress and the way you present yourself is almost in a lot of ways is demonstrating respect to the patient, that you are appreciative of them and you're taking the time to be professional and put forth this professional demeanor because you care. And that's a very different way of framing this conversation.
Yes, I agree. And beyond that, there's almost like a reverence that some physicians that I've observed have for the practice of medicine. Some doctors, I worked with a surgeon in my residency, and he always wore a suit every single day, Monday through Sunday. He worked 7 days a week. He came to the hospital in a suit, and he visited his patients on the floors. And then when it was time to operate, he would change into his scrubs, and then he would change back into his suit after the work in the operating room was done. Now, that's kind of an extreme, but it's one of the examples that I give of kind of like the reverence that some physicians have for the profession, and I think that's very admirable. And I think that having that relationship with patients, the effort that you put into it is important.
Yeah, I almost interrupted Kevin earlier, but he was saying similar things that I was going to say. But when it comes to some of the things that, unfortunately, in humankind, there are some people that, might give a bad representation of being a good physician. And there are things that happen to patients, or unfortunately situations where people start distrusting the medical profession. And I feel like, if anything, during this pandemic and all of the misinformation, disinformation, a lot of things have been going on that have created a lot of frustration in this country, for sure. I think it's even more critical that people feel like you are taking their care seriously and that you put forth the effort, because I think trust is the essence of what keeps this profession respected. In essence, respecting the patients, like you said, is a way for, us to be respected. And I think that you see that even if he did put the suit on every day as a surgeon, he does have a certain reverence, like you said, but also that serious, I'd have to say, somewhat of a seriousness to what they do. And I feel the same thing, that if you don't demonstrate that you care and that you are trying to be professional, I think we're going to end up missing something, and it will create a problem. And so I think there is a relevance to what you're saying. Sometimes I might just wear scrubs everywhere I go, but
Yeah,
I'm in the operating room, so it's a little different.
Yeah, to that point, patients want you to wear scrubs in certain settings. There's a study out of the University of Michigan near where I am. They're in Ann Arbor, we're in Detroit. They talk about wearing scrubs in certain areas of the hospital. Patients do not want to see you in a suit in the emergency department, and they don't want to see you in a suit in the operating room. They want their doctor to wear scrubs, and they want them to be clean scrubs in a white coat in the ER, clean scrubs in the OR or the PACU. There are appropriate places to wear scrubs. I'm not saying that everybody must wear a suit, but I think that the way we put ourselves together and the way we present ourselves is critical.
Right.
So when did you get this book in your mind? Like, when was this percolating? Was this a medical school thing when you're looking at interviews and maybe seeing people interviewing with you? Was this when you were in medical school? Where did this come from?
Yeah, it's actually my third year of medical school. And I was rotating on the oncology floor at a cancer hospital in Detroit. And I was, enthralled in this environment with physicians and nurses and patients. And I was learning a lot during this rotation. And I saw this really well-dressed man, crisp white shirt, great tie, long white coat, perfect slacks, leather dress shoes, the whole nine, looked great. And the nurses would say, "Hey, doctor, how's it going?" And he'd say, "Oh, I'm doing great today. Thanks. I hope you're having a blessed day." And about like 2 weeks into my rotation, I found out this man that was wearing a long white coat who looked like a doctor was a priest. And I said, "What? Are you kidding me? This is not right. This does not feel right." It's, the white coat is something that's sacred, that connotes like a doctor-patient relationship. I understand that clergy have a healing relationship with patients, but I was not expecting this clergy man, this man of the cloth, to be wearing the white coat. It struck me as wrong in a way. And it would be fine if he just wore the white coat. And then when somebody said, "Hey, doctor, how are you?" he would say, "No, I'm actually a priest, but thank you. Good morning." The casual assent that was confirming of that opinion was something that really struck me and like rubbed me the wrong way. And similarly, I had another experience where I rotated with in residency, like a clinical nutrition, and she actually wore a short white coat with clipboard in her pocket. She had her name badge on that said, let's just say, Carly, nutritionist. And when people said, "How's it going, doctor?" she would say, "Oh, I'm actually a nutritionist, and I'm here to talk to you about your diet and what we can do to help you feel better with the right diet." And there it's like I have way less of an issue, but I just had all these experiences with people of all levels, clergy, doctors, nurse practitioners, PAs, phlebotomists, charge nurses wearing white coats in the hospital system. And I was like, okay, we got to draw the line somewhere. Not everyone in this hospital system is a doctor. And for some of those professionals, they were directed by their manager to wear a white coat because, of course, the hospital wants everybody to be wearing a white coat because it looks like there's so many doctors around here taking care of me, the patient. I just think that's wrong as well. And so I write about that in the book. I wrote this section called White Coat Confusion, where I really discuss like, okay, not everybody should be wearing a white coat. This is like a sacred garment. We have white coat ceremonies where people are given these as a privilege, and there is a certain like privilege and respect for the garment that people need to have, and I just didn't see that upheld in every situation. And that was like the genesis point where I was like, something needs to be said. I don't know what, I don't know how, but I'm going to write about this. And I did. I started writing about it in my 4th year of medical school. This book is like, it sounds ridiculous, but this book is almost like 8 years in the making, because I just had these thoughts and these emotions. I didn't really know how to process them around what doctors wear and why it matters. But as I went through my training, as I saw like a med school perspective, then a residency perspective, and then I was a chief resident. So I witnessed hundreds of applicants coming through a residency program. And I saw all the little mistakes that people would make in the clothing that they would wear that were just kind of distracting, that took away from them as a physician candidate for a residency program. And I wanted to let people know without, being too nitpicky about, what you can do to make yourself look great and not be distracting from an interviewer's perspective. And then going into my private practice perspective, I really see the way I dress as a form of, creating those relationships with my patients, presenting my trustworthy self as a trustworthy source of medical information, but also it's like a form of personal branding. People know me by what I wear each day. And that's kind of important from like a private practice perspective. So there's a lot there. There's so many layers. I'm sorry to go on a bit of a tangent there.
Well, but there is a lot to discuss, and I guess I'm gonna just put it. I'm a little concerned that there's so much that we can derail the conversation, because there's 2 big topics that I'm hearing here. One is the white coat, which I think we can spend an entire episode on, literally.
Yep.
Because there's so much there to unpack, and depending on who's listening to this, you may think that's not a big deal. There's a lot there. And then the second part is the professional point. So if you don't mind, what I'd like to do is I sort of, let's start with the white coat aspect a little bit, and then move over to the professional part, because you're bringing up this idea of dress as being to identify the individuals in your care team in certain situations. Yep. And that is so true, because those feelings that you had, I remember those very, very well, running around with the short medical coat, your short white coat. So people who don't know, it's like medical students typically have the short coat, and then the attendings had the long coat. And I think even there was color differences in some situations where there was a white and there was a gray.
Yep. And my colleague who did emergency medicine training in Chicago, he wore a brown coat. So like University of Chicago emergency department doctors wore a brown coat, which makes sense for the setting.
And that then was a very quick way to be able to identify people. So we didn't have this mistaken identity, or I'm going to use the term appropriation, almost professional appropriation.
Yes.
Is the way I kind of see it. And so could you expand a little bit more on when you were a medical student, some of the ideas that you had behind this, or the problems that you saw, other than, you have a clergy member that maybe they had a doctoral degree, but you're in a hospital and people are calling you doctor. If there's a code, they're not, I guess it's at the end of the code, maybe they're going to want you, but there's a big issue with that. So I don't know, I'd love for you to expand a little bit more on your experiences there, just in different settings as well.
Yeah, I think just one thing I noticed, this is a huge can of worms, but race, class, and gender also plays into white coat and professionalism. And so, for example, a lot of times I saw my female attendings in family medicine residency, or my female physician colleagues in my residency training, my co-residents being called nurse, because they were wearing a long white coat. The charge nurse was wearing a long white coat. They're both women. What's the difference? And I think that really muddies the water, and it makes it difficult for patients to conceive of, oh, my doctor is in a long white coat. She is the doctor. just, nurses should wear blue scrubs and the respiratory tech should wear pink scrubs, and the hospital assistants who are moving patients around the hospital typically wear black scrubs. And then when you throw in everybody wearing a white coat on top of that, it makes it very confusing for patients. And there's a big frustration there, because my heart hurt every time I saw, the 65-year-old male in bed 300 saying, "Oh, hey, sweetie, like, glad to see you. You're my nurse today." And it's like, "Oh, no, this is my doctor colleague, Dr. Smith or so-and-so. You need to respect this person." And, it's just unendingly frustrating to see that happen. And I know that it happens everywhere, not unique to my training program. So I'll digress.
Yeah, no, I just make a comment on that. Is even I find it, if you're in scrubs only and everyone else is in scrubs, kind of the flip side too is that it is a very common thing, where you try to introduce yourself as a physician and sometimes they don't even still hear you. They want to call you by your first name, which,
Right.
it's always, that's another topic we could go on a tangent on, but we won't. But yeah, there's 9 times out of 10, if I say I'm in the medical profession, they think I'm a nurse. It's just the way people are programmed for that. But Kevin, I'm sorry if I was interrupting you.
No, I think these are really important, difficult conversations that us as physicians, we go through training and we kind of stumble into these problems. There's not really a hospital manual on how to interject when a male patient or a female patient assumes that one of your colleagues is a nurse and not a physician. What should be said? We should write these things down, right? There should be guidelines on how to address these situations. Instead, we kind of like fumble through it, and it becomes this kind of awkward thing where we as a profession don't really think about what to say in these situations, what to wear in these situations to avoid this kind of confusion. And so one of the things I bring up in the book is like, okay, the NBA, the NHL, National Hockey League, NFL, National Football League, these are professional sports leagues, and they have a dress code. In the NHL, it's expected that you walk into the arena in a suit, with a tie preferably. The NBA, they have like bans on certain chains, they have bans on certain sayings on your shirts, they have a dress code that is to be adhered to lest you be fined. And we're a professional organization. We ought to have some kind of guidelines that help our profession take care of itself and allow our profession to have its best relationship with the greater public.
Yeah, and the institutions, what's fascinating is there is a compelling need for some places to make sure everyone feels important and respected, even though you still should be respected, even if you're a different role aside from a physician. And people are supposed to be called provider across the board. And so I think that's another topic.
Yeah, that is another huge topic. Yes.
I have to jump in because this just infuriates me, because those are two different topics, right? The idea that everybody needs to be respected and treated with respect is completely separate from professional identities.
Mm-hmm.
When I see people blurring that line and where we want this because we want to be respected, that is, I think it is a false argument in so many ways that these institutions have used. Because there should be pride in your profession, and there should be whatever your profession is, we should be respectful of. Like when you're looking at a hospital and you're looking at the housekeeping staff who does an amazingly important job, the fact that we wouldn't respect them because they're doing housekeepers or being housekeeping is ridiculous. And maybe some people potentially would, but then it's up to the system to support them in such a ways. But to blur it and say, well, we need to have a long white coat on everybody so they can pretend to be doctors in order for they get to get respect, that's an institutional problem, not a what I would say the professional aspect of it. And I do see it as a way that there's this creep to intentionally blur the lines in such a way to confuse patients in this way that people have these false egos that need to be like supported in some way. But
yeah, well,
This is much of the reason why I wrote this, because again, these are big topics that as medical students, residents, physicians, we kind of stumble through these without, at least some guidelines of how to think about this, how to reflect on these issues. And, these are some of the big reasons I wrote this book, because I encountered these frustrating situations pretty much at every step of training. There was something that I would peel back about our profession that, maybe I wanted to reflect on a little bit and write about.
mm-hmm. But
well, you're bringing up, oh, sorry, go
I was
ahead.
going to say the important thing about this book, though, is obviously they're spilling over in just the way we talk, that we have some bottled up frustrations about this, particularly with, we can talk about scope scrape, we can talk about appropriation of status, we can talk about blurring those lines when it comes to people everywhere wearing the white coats when it becomes this meaningless thing. But what I like about with you writing this book is in there, rather than rant and rail like I just did, but you've identified as a way that you can say, well, if we adhere to these standards of dress to identify in these professional mannerisms, that's something that we can do to at least retain a semblance of control and maybe at least put a perceptual shift out there, even if we can't necessarily do an institutional shift.
Yeah. And you're bringing up these topics, Kevin, that we've talked about so many times, of like bias and perception and belief and stereotype. I mean, this is the basis for, I think, a lot of this. Ego, obviously, is another one. Were you going to say something, Kevin?
Yeah,
Oh, I'm just trying to keep my mouth shut.
Oh yeah, I wanted to jump in and
Yeah.
You talked about bias. There was a great example that I talked in my book about. Actually, I'll bring up two examples. I don't know if you remember the medbikini controversy.
Oh,
God, yes. Yes.
Yeah, so I
It's an
talked
episode
about
on
that, where somebody from the Journal of Vascular Surgery went through female physician Instagram or Facebook accounts, and they commented on their professionalism based on if they were in photos in their bikinis or in photos in having a drink or a martini or a beer or something like this. And I talked about that just because it was an interesting topic, but also it talks a lot about our profession, the kind of the double standards that we have for men and women in our profession. And then secondary to that, there was an ad from the Figs Corporation that showed a female physician, a DO physician in pink scrubs with a medical textbook. And she comes onto the screen and the book's upside down. She kind of looks a little bit ditzy, the way they film this. And I think that part of what I want to educate physicians on is, the respect we should have for our colleagues, and also the way that we should be controlling the narrative on how people see us. And this should not be dictated by, a scrubs company about, the way others perceive us. And so I think we need to do a better job as physicians of thinking critically about what we wear and how we present ourselves to the world, to the United States, to the greater community, so that we can retain the respect that we have for our profession and that others should have for the work that we do as well.
I'm kind of curious your take on it as far as someone, and we won't dive too deep in this. I was just curious you have your professional life and how you interact with patients, and I don't know where that came from. But then
I'm a new dad.
That's it. But then, you're a human being and you have, your own personal life. And obviously there's things that are extremes that are unacceptable and whatnot. But do you feel like people should express more or demonstrate more restraint, or what was your take on it? Just your opinion. I'm curious.
Yeah, there's a lot there, obviously, but I feel like, we're kind of pulling the veil back in this social media era of what people see of us as physicians, because most of us have social media accounts, either Instagram, Facebook, TikTok, Twitter, etc. I think there's something to be said for posting only what you would want your grandmother to see.
Yeah.
That's one of the guidelines that my mom is my biggest fan on Facebook. So she sees everything I post. And so I would never post anything that would, be offensive to my mom. And so you'll see a lot of my posts, I have a lot of fun. I share a lot of relevant information about healthcare, primary care, Plum Health, or practice in Detroit, my travel adventures, but also, that's what it is. I have a curated image for what I want people to perceive me, and I'm only posting images that people will think, okay, this is a trustworthy physician. Not everybody has to adhere to those rules, but also, I think from a professional standpoint, we shouldn't be looking at others and like casting aspersions at other doctors for having fun on a boat in a bikini. That's not our job as physicians. Our job is to take care of patients.
Sure. Kevin?
Yeah, in trying to maintain that professional space is, I think that's the point, is if we're focusing on the professional space rather than the personal space, and keeping things focused on there, particularly in this day of social media, I think that gets very difficult to do. But as a profession, I think that makes more sense, as long as people aren't, in their personal space hurting other people or doing something egregious.